Big news for dental hygienists across Ontario. The government has just announced consultations on some major scope of practice changes that could finally bring us closer to what our colleagues across Canada have already been doing for years. If you're a dental hygienist or even curious about oral health care access, this is something you'll want to hear about. Hi everyone, it's me, Holly, dental hygienist from Tooth Goals Clinic here in Ontario. And here's what's on the table for registered dental hygienists in Ontario. Number one, the ordering of radiographs. So this means that dental hygienists could independently prescribe radiographs and not just take them under someone else's authority, which is what we're already doing now. And number two, become a radiation protection officer. So this would allow dental hygienists to be able to own and operate their own dental x-ray machines. And then number three, administering local anesthetic by injection in the orofacial complex, which means that we could freeze patients for scaling and debridement just like hygienists already do in other provinces. So these changes aren't random. They're part of a government push to expand scopes of practice for several healthcare professionals with the goal of improving access to timely care and reducing the burden of an already overstretched healthcare system. In fact, if you read the government's announcement, you'll see that pharmacists have a huge change proposed, which, as somebody who lives in Ontario and seeks healthcare here, I can totally get on board with. Now, here's the thing. Ontario is decades behind on this. Hygienists across much of Canada already have these abilities. In fact, if you take the dental hygiene program at an Ontario college, they teach radiography and how to administer local anesthetic already as part of the curriculum. Students are already trained, tested, and competent, but when they graduate in Ontario, their hands are tied by legislation. So this creates two big issues. Access to care. When dental hygienists can't order the very x-rays that we need to detect and monitor early signs of things like periodontitis and cavities, which are conditions that we are already trained to help prevent and manage, then it creates unnecessary delays, added costs, barriers that keep patients from receiving that timely preventive care. Thanks for tuning in, and I'll keep you updated as this process moves forward. And remember, the more that we advocate, the closer that we can actually get to real progress in oral health care. See you next time.